How does oxazepam compare to other benzodiazepines? How does oxazepam compare to other benzodiazepines? This is a question many people have, especially when considering treatment options for anxiety or alcohol withdrawal. Oxazepam is a benzodiazepine that is primarily used for short-term anxiety relief and managing alcohol withdrawal symptoms. It has some unique characteristics that set it apart from other benzodiazepines. First, let's talk about how quickly it works. Oxazepam has a slower onset of action compared to faster-acting benzodiazepines like alprazolam, commonly known as Xanax. This slower action can reduce the immediate reinforcing effects that often lead to misuse. However, it is important to note that dependence can still develop if oxazepam is used for a long time. Next, we should consider how oxazepam is processed in the body. Unlike many other benzodiazepines, oxazepam does not require oxidation by liver enzymes. Instead, it is conjugated directly, making it a safer option for individuals with liver issues. This unique metabolism can lower the risk of some drug interactions, but it does not eliminate the potential for dependence or withdrawal symptoms. When it comes to addiction and dependence, oxazepam shares risks similar to other benzodiazepines. Long-term use or high doses can lead to tolerance and withdrawal symptoms. Withdrawal can manifest as anxiety, agitation, and in severe cases, seizures. Although the slower onset may make withdrawal less intense than with short-acting benzodiazepines, the risk is still significant. Side effects are another important aspect to consider. Common side effects of oxazepam include drowsiness, dizziness, headache, and vertigo. Compared to diazepam, also known as Valium or alprazolam, oxazepam may cause less severe sedation. However, it still poses risks for cognitive impairment and motor coordination issues. The potential for abuse is present, especially when combined with other central nervous system depressants like alcohol or opioids. In clinical settings, oxazepam is often chosen for managing alcohol withdrawal due to its specific pharmacokinetic profile. While other benzodiazepines like diazepam or lorazepam are also used, they may have different patterns of abuse. It is worth noting that oxazepam is prescribed less frequently than some other benzodiazepines, partly because its brand name is no longer available, and it is mainly found in generic form. From a substance abuse perspective, the slower onset and intermediate duration of oxazepam do not eliminate its potential for misuse. Individuals with benzodiazepine addiction may misuse oxazepam just as they would with other benzodiazepines. Managing withdrawal requires careful tapering, regardless of which benzodiazepine is involved. Combining oxazepam with alcohol or opioids significantly increases the risks of overdose and fatal outcomes. In summary, oxazepam shares many addiction and dependence risks common to benzodiazepines but differs in metabolism and onset of action. These differences influence its clinical use and side effect profile, but they do not lessen the importance of careful prescribing and monitoring for substance abuse and addiction.